such a pleasure to be here with you this morning. Thank you for having me. I'm going to share with you some aspects of my journey so far through the worlds of technology and health and what they've taught me about what I know to date about the future of health. So I began my journey as a molecular biologist. I thought that the genetic code had all the answers, and that understanding to read that code, how it varied, how to manipulate it, would allow me to have the biggest impact on problems as big as cancer and HIV. While I was working in the lab, I also volunteered as an interpreter in a nearby clinic. I grew up in the US, but my family's from Chile, and so I learned Spanish at home. And as an interpreter in the clinic, I was able to hear patients' stories. Indeed, I had to repeat the stories. And I began to understand that the biology, the pathology, only matter in the context of these stories. Everyone has a unique perspective that defines how they see disease, indeed, what health means to them. And so my story then took me to medical school and then medical residency. But it turns out that I am a geek. And during my medical training, I saw how little data was being used in the practice of medicine. We talk all the time about evidence-based medicine, but a typical doctor has essentially no chance of understanding and applying all of the relevant data to their patients. So I changed gears a little bit, and while I still see patients part-time, I spend most of my time now using medical informatics to apply computer science to the problems of medicine. And that in turn led me to Google, where I spent an amazing 6 years up until just 1 month ago. One of my favorite projects at Google is Google Flu Trends. And what you see in orange is a graph of data from the US Centers for Disease Control that counts influenza cases based on data from laboratories and doctors' offices. In blue, you see Google's estimate of the same phenomena, which is based only on an analysis of the data being entered into Google search boxes. And because we can do our analyses overnight, instead of collecting data via processes involving lots of humans, the data from Google is available 1 or 2 weeks ahead of that of the CDC. And to me, one of the things that this teaches is the power of taking tiny stories as entered into the Google search box and turning them into data. The other Google story that I want to share with you is that of a more recent feature currently available only in the US called Symptom Search. And what happens here is that for a query like cough at night, at the top of the results, you see asthma and acid reflux. These are suggested health conditions that may be related to the query. And the amazing thing about this is that unlike many of the symptom checkers that you may have seen online, Google has no mapping between a given symptom and a given disease. Instead, what happens is the query is issued and the search results are returned in the normal fashion. But in real time, we analyze those results to look for which health conditions seem to be discussed. So despite the fact that Google actually doesn't understand anything about the concept of cough, there are quite relevant suggestions about what conditions may be related to that symptom-related query. But it turns out that many questions are far more complex than the ones we just discussed. I was studying how people use technology like the internet to answer the hardest questions, like which chemotherapy will give me the best chance of surviving my cancer. And in this journey, I met a special man named Friedman. And over the last 17 years, he's been building online communities of patients, of cancer patients, who are asking these very hard questions. And they're getting amazing answers from each other. I said earlier that doctors have essentially no chance of finding all the relevant information and applying it to a given patient. But it turns out that a smart patient, when faced with a life-threatening diagnosis, in a very short time can become an expert. A doctor generally has to learn about a huge amount of information, many diseases applied to many patients. An expert patient, just one, very specific disease. And we're not talking about crowdsourcing here. We're talking about people becoming micro-experts in the domain which matters to them most, in this case, because their lives depend on it. As I was thinking about this problem, I was reminded what it's like to be a patient. In last August, I had a subarachnoid hemorrhage, a bleed in my brain. Most of the time, this results in death or severe disability, but I was incredibly lucky. I had a subtype of bleed, which caused no long-term damage, and I have the same chance of this happening to me again as any of you do. One consequence of this experience is that I had the privilege of collaborating with Lucy and Engelin on a project called My Health Story, a site where many people share their health stories for the benefit of other patients, doctors, and perhaps most importantly, medical students. My story is there, and I hope that many of your stories will be there too. I also learned that I am very impatient. And so I talked to Gilles Friedman again, and we asked each other the question, how can we scale the power of the expert patient? How can we help patients help even more patients? And collaborate with scientists to make new discoveries that will in turn help magnitudes more patients. So a month ago, I left Google and with Gilles started a new venture called Impatient Science, where we will tackle these problems. And I hope to share more with you about that soon. I think we've done a good job in recent years of putting the patient at the center. We talk a lot about patient-centered care, and we know that we need to listen to patients, not just their symptoms, but their values, their preferences. And now it's time, I think, to talk about patient-centered research, which means that as researchers, we need to tap into the expertise of patients. They are uniquely positioned to help the patients that come after them. So we need to listen carefully to our stories, to the data and the narratives within them. There are expert patients all around us. They are networked, and they are asking and answering some of our hardest questions. And they're no longer passive recipients of our treatments or passive participants of our clinical trials. They are impatient, they are experts, and they want to collaborate. Thank you.